There are a very limited number of states that allow individuals to legally choose euthanasia or assisted suicide as an end-of-the-life option. People who are suffering from an incurable or painful disease should not be forced to live because another person decided it's what's best for them. The idea of euthanasia and assisted suicide is a controversial topic that needs to be discussed more often. In this speech, I will discuss what euthanasia is, why people would choose euthanasia, and lastly, who should be allowed to make the decision for the patient. Firstly, what is euthanasia? It can be defined as the painless killing of a patient suffering from an incurable disease or an irreversible coma. Although similar, euthanasia is different than assisted suicide. Euthanasia is administered by a physician, while assisted suicide is when the physician supplies the drug and the patient administers it. In most countries, assisted death is against the law and it may carry a jail sentence. In the United States, the laws vary between states. Individuals who want physician-assisted death must meet certain criteria, including having a terminal illness, providing that they are of sound mind, and voluntarily and repeatedly expressing their wish to die. Once this occurs, the patient takes a specified lethal dose of drugs. The recommended drug for this procedure are barbiturates, which are a group of drugs known as sedative hypnotics. There are many advocates and people who have influenced euthanasia and assisted suicide. One was Dr. Jack Kevorkian, who was a licensed doctor in Michigan who not only supported euthanasia and assisted suicide, but helped people live out the request to die through assisted suicide. He was known as Dr. Death because of a mechanism he created called the suicide machine, which allowed for patients to press a button that injected them with a lethal dose of medication. Kevorkian faced 4 trials but was not convicted. He believed he was doing what every physician should do, which is listen to the patient and respect their wishes. Later on, he took it one step further and began participating in euthanasia practices. Once this occurred, he was convicted for 8 years. Dr. Kevorkian's work created a divide in the medical community. Dr. Quill was another physician who challenged the laws prohibiting physician-assisted death. He took the debate to the U.S. Supreme Court in 1997. Although he lost 9-0, there was a lot that came out of the case that brought palliative care forward. Lastly, Barbara Coombs-Lee is another advocate for the right to choose. She is the senior advisor and president of Compassion and Choices, the nation's oldest and largest nonprofit organization working to improve care and expand choices at the end of life. In 1994, she became one of the chief petitioners for the Oregon Death with Dignity Act. People like Kevorkian, Quill, and Coombs-Lee are important to improving care and expanding choices at the end of life in more states. There are many reasons an individual may choose euthanasia or assisted suicide. Disease-related symptoms are one example. Although doctors can dramatically help patients live comfortably and ease the pain in the time they have left, some would still rather choose death. An example of this is 54-year-old Michael Marasco, whose cancer had spread to his bones. He felt keeping him alive was only prolonging the inevitable and wanted to help wanted help from Dr. Quill to die. Michael believed, like many others, it should be his right to make this decision. Secondly, the fear of future suffering. Patients who are diagnosed with a disease they know will have terrible symptoms may decide euthanasia is the best option for them. An example of this is Thomas Hyde. He was diagnosed with ALS at the age of 29 and reached out to Dr. Kevorkian a year later. The disease took over his body very quickly, and it was clear he did not want to suffer any longer and was afraid of what could come in the future. Lastly, the feeling of being ready. An example of this is John Ream, who had been suffering a long decline from Parkinson's disease. When he announced to the doctor that he was ready to die, John was told that he could not be assisted. The only way for him to do this was to stop taking his medications and stop eating and drinking. It is truly heartbreaking to me that individuals do not have a right to peacefully die if they are ready with the help of their doctors. A frequently asked question is who should be able to make the decision of life or death. The patient should be the only person who is able to make this important decision. If they are in the right state of mind to be making the call and have persistently shown their interest in this option, their request should be granted. Doctors work to help individuals get better and feel like themselves again, and sometimes the patient's wish of dying is the only thing that will accomplish that. A very scary and real example of this is Dax Cowart. Dax and his father were victims of a horrific explosion. 100% of his body was burnt. Dax was taken to several burn wards where doctors did everything they could to keep him alive, which included excruciating treatments. Cowart would tell anyone who listened that he did not want the treatment and simply wanted to die. The doctors did not listen to him and continued treatment, which often included bleach baths to prohibit infection. Dax went on to live a fulfilled life. He became a very successful lawyer and continued to fight for patient rights. He argued that patients should have a choice in whether they receive treatment or not. Even after living a successful life, he still believed that doctors made the wrong decision. The only difference in his opinions as an adult was he felt stronger about it. Today, I reviewed what euthanasia is. I explained some of the reasons someone may want to go through with euthanasia, and lastly, I discussed who should be able to make that decision. People who are suffering from an incurable or painful disease should not be forced to live because another person decided it's what's best for them. In the end, a person should have the right to choose life or death. Bringing this issue to light can open up conversation and create much needed change in this world. No human being has the right to force another human being to undergo that kind of pain. Thank you.